Does hyperbaric oxygen therapy help those with seizure disorders diagnosed with epilepsy? Does hyperbaric oxygen cause seizures or even cause epilepsy? Is there any connection whatsoever between hyperbaric oxygen and seizures? That's what we're going to cover in today's video. So, is there a connection whatsoever between hyperbaric oxygen and seizures? The answer is yes. On one end, hyperbaric does seem to help those with epilepsy. And on the other hand, at very high pressures, at very high percentages of oxygen, it is possible that hyperbaric causes a thing called oxygen toxicity. And oxygen toxicity may induce a seizure in its most aggressive version. That being said, should somebody with epilepsy be nervous about going into a chamber? Or should a patient who doesn't have epilepsy become nervous that it can cause a seizure and now they become epileptic? Let's talk about all of these versions. Let's start with those who have already been diagnosed with epilepsy. If you've been diagnosed with epilepsy and you have some version of a seizure disorder, should you be nervous about going into a hyperbaric chamber? The answer is ultimately no. Almost every neurologic condition treated in a hyperbaric chamber should be treated below 2 atmospheres on 100% oxygen. In our office, we often treat neurologic conditions somewhere between 1.3 to 1.5. Occasionally, we go to 1.75, but we always keep people with neurologic issues, particularly epilepsy, below 2 atmospheres. If we treat below 2 atmospheres, whether it's 90% oxygen or 100% oxygen, the risk of oxygen toxicity is excessively low, virtually almost impossible. And so if we treat someone with seizure disorder within those low to mid ranges of pressure, not only is there no risk of oxygen toxicity or causing an oxygen seizure, in fact, the opposite is what we see. We see seizures reduce both in frequency and in intensity. And in many cases, we see them reduced to a point where we actually get them pretty well under control. So I feel very comfortable using hyperbaric oxygen with those with seizure disorders, knowing that we can see improvement in their neurological activity. And so on the epileptic side of the conversation, what are some of the mechanisms that may be at play with regard to hyperbaric improving some of the symptoms associated with epilepsy? Well, it does appear that by exposing people to these mild ranges of pressure, number one, we get improved mitochondrial function. So we get better ATP or cellular energy production from these neurons. 2, this enormous neuroplastic effect. In other words, neuroplasticity inducing changes in neurons, improving their health, improving their signaling function. And number 3, we tend to get this balancing of neurotransmitters. And so between those 3 areas, it does seem to calm the brain and reduce the intensity and frequency of these seizures. If you have not been diagnosed with epilepsy and you do not have seizure disorder, is it possible that the chamber causes a seizure? It is possible. It's a thing called oxygen toxicity, specifically central nervous system oxygen toxicity. And at the higher pressures on 100% oxygen, the body tends to vasoconstrict, especially in the brain, reducing the amount of oxygen making it to the brain. However, due to many different circumstances internally, as well as just the overall exposure to the oxygen and the duration of the oxygen, it is possible that this heightened amount of oxygen at really high end of the pressures causes neurologic firing to occur, leading to convulsions or a seizure. Should that happen, number one, that is extremely rare. It's less than 1 in 50,000 typically across the boards of all different metabolic health. So the healthier you are, the healthier your metabolism is, the more you can withstand higher pressures of oxygen. When you have metabolic disease or diabetes of some kind or insulin resistance, some of these are the risk factors associated with increased likelihood of oxygen toxicity. If someone did have a seizure in a chamber because of central nervous system oxygen toxicity, are they now epileptic? The answer is no. That is a moment in time. It is an expression neurologically from too much oxygen in this particular moment. And once the oxygen is removed and the oxygen levels come back down, this person is in no greater risk of having further seizures down the road. And so they do not need to see a neurologist. They do not need to be evaluated. They do not need to go on epileptic medications. It is not epilepsy. It is a moment in time due to an excessive amount of oxygen in that moment. That being said, there's also very simple ways, even if we have to treat at high pressures, to avoid central nervous system oxygen toxicity. They're called air brakes. So if we keep somebody on 100% oxygen at higher pressures, like 2 atmospheres and above, then every 20 to 30 minutes, we just take them off oxygen. We let them breathe regular air for 5 minutes at a time. And like I said, oxygen toxicity is so rare, it's less than 1 in 50,000. And yet, by taking them off oxygen for 5 minutes every 20 to 30 minutes, we can reduce that to even lower amounts. So it's not difficult to keep people safe and away from seizures, even in central nervous system oxygen toxicity, even when we have to treat at higher pressures. So are these two connected? Is hyperbaric oxygen and epilepsy somehow connected? Yes, but we treat those with epilepsy at much lower pressures, keeping them very, very safe from central nervous system oxygen toxicity, while also helping to improve some of their symptoms neurologically. And then when we have someone who's not epileptic, could they have a seizure? Yes, but are there steps that we can take, even if we're treating at high pressure, to keep them safe and to really reduce the risk of these seizures? Of course there is. That's what we teach when we teach our courses. That's what we teach when we instruct our technicians and doctors about how to create protocols for their patients. And that's how we know how to keep both categories of patients safe and seizure-free. I hope this helps answer the question of what is the connection between hyperbaric oxygen and seizure disorder and seizures in general. Thanks again for your attention, and we'll see you next video. Whether you're a chiropractor or a naturopath or an acupuncturist or a DO or even an MD, but you're looking at hyperbarics through this lens, the lens that I'm describing, which is applying hyperbarics for all these off-label conditions, this is the class that teaches that. And right now it's the only class that teaches this type of hyperbarics in this way, and that's an actual certification course. Check out hbotusa.com, and right across the top you'll see upcoming events. You can click on that and it'll show you when our next courses are going to be.